I think we had a really good, at least I know Les and I and some other key folks in our department, I think we worked really well together, and always had his support. I knew he always had my back, and I think that was important, and I think that was one of the things about our team. So once we got our team kind of set, it was pretty much like, you do this, you do that, and then just having those same people and getting to know different people I never met a sheriff's department, I've never worked with the sheriff's department before. So, getting friendly with them, knowing their background, and just supporting each other every day at the sites was big for me. And then, we still had other operations going on, like I still had to manage my tuberculosis patients because that didn't stop. So they were still running their clinics, those patients still needed their meds. So there are other operations that could not cease. And then I was like, we haven't met as a group, what are we gonna do? But we didn't wanna meet because you're not supposed to be 6 feet apart, and what are we gonna do? So I remember we did out here at Erickson under one of the tents, the drive-through tents, I did a nursing staff meeting, and we just kind of vented, and then we did like a paint and sip, but it wasn't, we didn't have wine, but we brought our lunch, and then we had little things, and then the nurses just sat in the parking lot and painted on this little canvas. And for me, that was really nice. It kind of let us decompress and not think about COVID, and just kind of get together as a group. But and my family was great. My daughter actually had to write something for school, and she wrote how proud she was of her mom, and that kept me going. Because I want, you have to be, show them that you're doing good for the community, and that was really important to me that, she took the time to, do that paper for me. So I have that paper still, and, I look at it every once in a while when things get tough, but, I think really just being there for each other at the time was invaluable. It really was.
It's easy for me to say, this is my staff, and but I know my staff, and I know I have a good staff because over the last 12 years, I've hand-chosen a lot of them for certain positions and certain management. So we work together, we know how to work as a team, and it's just that support, because I know I can say to Mary Beth and even Sherry, the day we stood in my office over on Kennedy Boulevard, and I said, we have 2 days to figure out how we're going to do these saliva tests. I knew that as we sat there and we talked about it, we would solve the problem. And it doesn't say that we would do it right the first time or we would do it great. We did, okay? That was the, we were the forefront of attention because we were the first county or agency to even do that saliva test like that.
In the world.
In the world.
In the world.
Okay, so we were front and center, and it was the grand stage. I'm not one for grand stages, I'll be quite honest with you. I am not that type of a person. I'm not one to be in front of the camera or to take the credit. We have a team of people that were there, and I mean it's public health. It was in our Department of Public Safety alone, our emergency management folks, our prosecutor's office, our sheriff, whether it was weights and measures, consumer affairs, the medical examiner's office, because that's a part of this that we can't forget. We were working with our medical examiner's office because we were getting notified of people who were decedents, and we needed to know whether they had COVID or not. And I know actually one was actually a patient of my personal physician, our family physician, and I was on the phone with her, and she's like, so, these are things we went through, but the one thing that I was confident in through this whole thing was that we had a staff that would do this. And some people might say, I'll take it a step further. You might say, oh, well, you have to say that because you're an office director or whatnot. But we have a team here in the county, from the then freeholders, now commissioners, to our administration, that there was no doubt. I mean, when this first occurred, I was asked, you're going to need some funding for this. What do you want? I said, I don't know, give me $1 million or something, and then I'll let you know if I need more, because I don't know what I'm going to need right now. It wasn't $1 million. It was like $25 million. Here it is. If you need it, okay, you get what you need to do this. we got support from them. We were on the phone, but we worked as a team through this. And that was the thing that I think we should all be proud of, that we were part of that team. Like I said, every single one of my employees, my volunteers, and we have probably, if you take our full-time staff, part-time, and our volunteers, we have well over a workforce of 200 people that came out to help, plus everybody else, that came in to help.
So if we had another pandemic, and the advice I would give is definitely trust your instincts, trust your team, and just be there for each other. I think that was the most important. Some of my best days were sitting in our trailer, freezing cold, but just sitting in the trailer, just talking with my coworkers and what we're going to do. So definitely lean on each other, trust your judgment, and it'll be fine. And then 50 years from now, I just want to be remembered as the team that, or the division that did for everyone. I mean, it didn't matter if it was the community or our coworkers, just being there. And I cared for everyone. I would get calls from random county employees that were scared, and I'm not really sure, but just having that other person supporting you and reassuring you that I think everything's going to be okay, even though I might not have thought it. So just for me, it's just knowing that the nursing division was there, not just for the community, but I think we were there for our employees and our staff and our families. That's what I think I would most want, that we were there.
I think the only other thing that we need to recognize, and we've talked today about our staff, we've talked about the county staff, but there's an even bigger, larger universe out there, and that was every municipality, all of our partners, our hospitals, the farm. Everybody was in on this. Everybody had to be a piece of it in order to do what we had to do. So they all need to get accolades for getting through this as well.
Yeah, and without the support of our community partners, we wouldn't have had a place to give vaccinations. So, the churches stepped right up, townships stepped right up. We were at a hotel, and they were more than accommodating. So I think, people really came together and offered their services and were so kind to our staff. And, we really couldn't have asked for better community partners. They were wonderful, definitely. And the municipalities and the firemen, the EMTs that were there on site with us, our medical reserve corps. Those were people that weren't getting paid, and some of them were there every day. We had a core group that just kept coming, and employees that were retired came back and helped. So I think those kind of the unsung. We can thank myself and Les and administration, but there's the boots on the ground, people that secretaries that came out and we taught how to swab, so it was like a lot of those people that you wouldn't normally think of recognizing, but they were there. Definitely they were there, and we couldn't have done it without them, for sure.
The moment that I was most grateful and proud, there wasn't one moment. I can't say there was one particular moment. I was grateful and I was proud for my team, my public health team here, every single day of this pandemic, because we would not have been able to get through it without them, without their energy, without their work, without their dedication to what they did. And nobody really complained. They just went to work and they did what they had to do. Personally, that's what I'm grateful for, and I'm very proud of them. But I'm also proud to be part of a larger organization that supported what we did during the pandemic, and gave us that support.